It's 12:30. Good afternoon to you on a foggy little day. Brian Dust, are you playing fog music? I can't hear you.
That would be a good idea.
Foggy music. Foggy Mountain Breakdown would be a good one for today.
We are doing bear theme songs today.
Themes. About bears, huh? That's
yes,
pretty cool.
It is cool.
I'm doing songs with people's names in them. Like Hot Rod Hearts, I put for Rod.
Yeah.
That was a stretch, but I wanted to hear it, so there you are.
It'll work.
Dr. April Ritz in the house. She comes rolling in here from our friends at Pelvic Health, and it's very good to see you. How you doing?
Doing great. How are you guys?
Fine. Weren't you in here yesterday?
I was.
Okay,
I was in
just
here.
checking.
Early.
Yes, 8:30 yesterday morning.
Yeah, it's a little different to be getting up that early and rolling in, but I'm sure it was a fine time. But now we're gonna bust it out here and see what's shaking with you guys. What do you got going on?
Yes. Well, we have a lot actually coming up. Just briefly on some classes we have coming up in February. February 6th, we have our postpartum class for any moms that are pregnant or just recently postpartum. That's February 6th. February 13th, the following Tuesday, we have a class called Low Tox Living, and that is a free class, open to anybody to come. We're just talking about ways to live cleaner in our homes for our children, regarding any cleaning products, our laundry detergents we're using, shampoos, things like that.
Okay, that could be very interesting.
Yeah, it should be a good class. February 20th, we have our menopause class, which is what I want to talk about today.
All right.
And then February 28th is our IBS and pelvic floor. So February is a busy month.
Well, I'd say so.
Yes.
Yeah, it's a short month, too.
Well, if you only knew the people that schedule those, you could get that figured out.
Right.
But that's good. Yeah, keep you busy, keep you out of trouble, and keeping the people informed. That's what it's all about, and spreading the word on a little pelvic health for you.
Yes. Yeah. So today I really wanted to talk about men and menopause.
Men and menopause.
Two separate things.
I don't think men have menopause, do they?
You are correct there.
Well, I mean, we just get older, so we got that. But this will be great. Maybe people don't understand that you actually do treat quite a few men, don't you?
Yes. So a lot of people think of pelvic floor physical therapy as a woman's only issue, and it is not. We have actually been seeing more and more men in our clinic. So just briefly touching on some of the things that we treat for men, we treat urinary urgency, leakage, and also post-void dribbling, which is after a man urinates, having a little bit of leakage after that. We also treat with men rectal pain or pelvic pain. Some men we see they have a sensation that they're sitting on a golf ball, or they're getting spasms and cramping in their pelvic floor area. And then we also treat just general, a lot of hip pain, back pain. We're seeing neck pain as well. And then for little men, for little kids, for boys, we're seeing some urinary or bowel incontinence issues or leakage issues. So, just wanted to throw it out there that we treat men.
Okay, neck pain.
Yeah.
That's not very close to your pelvis. I just want to throw that out there.
It's not, but do you know that it's all connected?
Absolutely.
Yeah.
Yes, the jaw, the neck, the spine, it's all connected.
It's very interesting. So you can treat all those pains and sufferings that we are having.
We can.
All right. So, and men, you shouldn't feel embarrassed about it. If you're hurting, there's no shame in the game. You just need to get it taken care of, because it probably can get taken care of.
Yes, and that's the thing too. A lot of men, just in general, not to be stereotypical, but they don't want to go to the doctor, or they're fine, it'll get better.
Yep.
But a lot of times they wait until they wait and they wait and they wait. We actually recently had a call. I know I was supposed to see you guys like a year or two ago.
A year or two ago.
Yeah. And it's just gotten so bad now. I need to see you guys. So it's like, yep, we're here for you.
All right.
So any stage, whether symptoms are just starting, you're starting to deal with some pelvic floor spasms or pain, some urinary urgency issues, whether you're there or it's been years, we can treat you either way. But we always say the more acute the issue is, the better it is to get in. You won't have to see us as long. You'll get better faster.
That sounds great. Yeah, don't put it off, because it'll just take longer to fix.
Yes.
Mm-hmm.
All right, so that's really good. So men, if you're out there listening, get in touch with the F&M Pelvic Health and Wellness. They can help you out, so you don't have to suffer in that pain anymore.
Yes. And then menopause.
All right. Why is it called menopause?
Yeah, why is men in there?
So why is men in menstrual health, menopause? Do you guys cause those issues?
We have a lot to do with it probably, but
no. So men like menstrual health. So menopause is the pause or cessation, the ending of your menstrual cycle.
Mm-hmm.
So menopause. I don't know. Actually, I don't know.
I always wondered if they come up with that name because, there's difference between a man and a woman. But like if your menstrual problems are going to start disappearing, and the menstrual actions disappearing, they think you're turning into a man.
What?
Back in the days. Back in the days.
Yeah, back in the day. I have to do some history, like research on the history
do
of this.
some of that because I don't have time for that.
Yeah.
You're not very busy.
I don't know if I have time either, but it's
all these classes. Yes.
But I always wondered, because they call it menopause. I don't know. Anyway, let me know next time you come in.
I'm not sure. That's a great question.
All right.
But yeah, so menopause is technically the period once you have gone 12 months or a year with no period.
Okay.
That's when it actually starts. Average age is about 51. So this class we have coming up is called The Change, Perimenopause and Menopause. Perimenopause is the time before menopause, but it's when our hormones start kind of fluctuating a little bit. This can start as early as like in the later 30s, definitely happening in women's 40s. So some of the symptoms that women may experience, well, there's a lot of symptoms.
Oh, yeah.
But regarding our clinic and what we can help with, it's called genitourinary symptoms of menopause. So we can help with anything in the pelvic floor region, genital region, and the urinary symptoms is what we treat in our clinic.
Okay.
So some of these symptoms may be vaginal dryness or pain or irritation, pain with intimacy, urinary leakage, prolapse symptoms. So that's what we can help with regarding menopause. And then Tiffany Mosley, she is an advanced practice nurse and a midwife. She's also teaching the class with me.
Oh, that'll be good.
And she's a women's health provider. So she can address more of the other issues such as like the hormonal imbalances and helping with like hormone replacement.
Okay.
So we'll be going through a bunch of different topics in the class. But I just wanted to briefly touch on the genitourinary symptoms of menopause and how our clinic can help with those.
Sure, that sounds interesting.
So we are always addressing, as you guys know, the muscles and any weakness or tension that can be present in those muscles, as well as during this time period, the tissue starts to dry out some. So we're educating women on fluid and diet, vaginal moisturizers, lubrications, overall wellness, sleep, and stress management during this time of somebody's life is really important as well.
Huh.
So we address so many different things, not just the pelvic floor.
Yeah, absolutely. So if somebody is actually, maybe somebody in their 40s is just now starting to notice these, changes in the body, what should they do? Get a hold of you guys as the first thing and say, hey, here's what's going on?
Yes. So if they're starting to experience any of the genitourinary symptoms, I would call our office. And like I just said, the sooner you can get and address something, the better it's going to be. Call our office and we will do an evaluation with you. And we will spend a good 1 to 2 hours with every patient on that first visit. And then our treatments are 1 hour in length. So we'll go through full history, figure out what symptoms you have going on. And then also during this time period, we work a lot with the gynecologist in the area. Sometimes just a simple moisturizer that we recommend in the clinic that's like good ingredients can help, but sometimes our patients need more of like a topical cream in that area, and we cannot prescribe medications.
Okay.
So we refer them to a local gynecologist to help with that.
Oh, okay. So it's good to know that you guys can all work together and get that taken care of.
For a lot of things, we like to work together in unison.
Very nice. All right.
The things that you're mentioning there, I'm just kind of curious. Are you treating basically things that most women would say are normal for this time period, or are you treating things that it's like, well, this is a kind of a different case? I'm just curious.
Well, we see everybody that has issues going on in our clinic.
Right.
But there are women that go through perimenopause and menopause fine, and they really have minimal symptoms with no issues.
Okay.
But I would say it is very common during this time frame to have more vaginal dryness, have pain with intercourse, have some discomfort in that area, and some leakage issues that are now starting to pop up. I would say that is common.
Yeah.
But like we say, there's a lot of things that we see that's common, but it's not normal, and it can be treated.
Sure. That's the big thing.
Yeah, you don't have to deal with it, so that would be a good thing for everybody involved, I do believe.
Yeah.
All right. So first step is say, okay, I'm having some issues. How do you get in touch with you guys and getting the ball rolling?
Yeah, so if you're having issues, give our office a call, Effingham Pelvic Health and Wellness. Our number is 217-705-5077. You can also follow us on Facebook. And then I highly recommend any women in this age range, even if you're not having symptoms, to come to this class. It is February 20th from 5:30 to 7:30 p.m. at our clinic. And we will be going over hormone changes, common symptoms, perimenopause, and the true definition of that, how to ease the transition. We'll be going into exercise, lifestyle, nutrition, hormone replacement therapy, supplements, and pelvic floor therapy. Questions that you can ask your provider, red flags that should be addressed during this time frame if they pop up, and then we'll have a question and answer. The class is $25, and we already have several people signed up, and we are limited to 18 people in our clinic space.
Okay. I do believe that would be a very good $25 spendage right there. You can get lots of information.
Yes, and save you from having to do hours of research on your own at home on Google.
That's a huge thing. Yeah.
That may not be evidence-based.
Like trying to find out why they call it menopause. There's your Google search. It'll be awesome. Very good. Well, always a pleasure having you here, and good luck with all your shows and all your classes coming up in February. You're going to be a busy gal.
Yeah, just hop on our Facebook page, check us out, and all those classes are on there.
Awesome. Very good. Dr. April Ritz, F&M Pelvic Health and Fitness. We appreciate what you do, and keep on doing what you're doing, okay?
Thank you.
All right. Stick around. More fun coming up. Brian Dust, talk to you on the drive home.
Sounds good.